Welcome to ChiroSphere, where we talk about all things chiropractic and some things, well, not so chiropractic. I'm Dr. Ray Foxworth, your host for ChiroSphere and CEO of ChiroHealth USA, the network that works for chiropractic. Folks, you're in for a treat today as we welcome a true luminary in the chiropractic profession, Dr. Bill Morgan. With a career of remarkable achievements and groundbreaking contributions, Dr. Morgan's left an indelible mark on healthcare and chiropractic care alike. A proud Texan and seventh president of Parker University, Dr. Morgan's journey began with a stint in military healthcare, from serving in the Navy to becoming the White House chiropractor, impressive. Chiropractor to Congress, impressive. Dr. Morgan's dedication to serving his country and advancing chiropractic care has been unwavering. Throughout his career, he's received numerous accolades, including the prestigious American Chiropractic Association Chairman's Award of Valor and the title of Chiropractor of the Year. His commitment to excellence and leadership has earned him the respect and admiration of colleagues and patients, and certainly of me. Today, we'll delve into Dr. Morgan's extraordinary journey, his insights into chiropractic care, and his vision for our future. Welcome, Dr. Morgan.
Hey, Dr. Foxworth, thanks for having me.
Absolutely. So truly, I'm trying to remember how long I've known you. I think the first time I met you was at an ACA event when you were teaching on MRI. That's been a minute for both of us. We both probably had a little more hair back then, maybe.
I don't think I did, but yeah.
Yeah, maybe not. So over the years, obviously, I mean, you've held some positions that you've lived kind of the chiropractic dream, like I have in many ways. What are some of the pivotal moments or experiences that shaped your journey in chiropractic care and in healthcare leadership?
Well, I was in private practice for 13 years, and my wife and I became some of the first chiropractors in hospitals back in the 90s. And to be integrated in a civilian hospital and to really see how much chiropractic has to offer in those settings. And I had people have talked to me, well, why would a chiropractor want to work in a hospital? And of course, the answer is because that's where sick people are. And it really showed me how adequate our education is and how great our treatment options are, especially in a world that has so many medical options. I remember when we started off at Bethesda Naval Hospital, there was 2 providers and 2 chiropractors. And we became very busy for people looking for drug-free options. So those were a couple of pivotal moments there. But also, there's one point when I first landed at Bethesda, and there was people who didn't want chiropractors in a hospital, military hospital. And we were in the first tertiary care hospital in the world for chiropractic. And I remember there was a patient that came in and he had headaches. And he failed physical therapy and been to medical doctors. And as I did my review of systems, as we teach at every chiropractic college, I got to the ears and he talked about, yeah, I've had some ear trouble and trouble hearing. And in my examination, I could smell. He didn't smell really good either. And he had headaches. And I took my otoscope out because that's where his symptoms were. And I looked in his good ear, looked good, and looked in the other ear, and there's this gray pulpy mass. And it turned out he had a Pseudomonas infection that had consumed his mastoid. Wow. If I had adjusted him without examining him, I probably would have probing what was left of his mastoid, which was eggshell thick, and introduced that Pseudomonas infection to his brain. So finding that, even though it wasn't typically what you consider chiropractic, I gained the respect of most of the other physicians at the hospital, and they realized that we missed this, the chiropractor found it, and that in addition to the care we give, we have world-class education and identifying conditions, and also we understand when to refer and, of course, when to treat.
Yeah. You know, I had a similar experience. I started the VA program here in Mississippi, one of the first 17 sites that did that. And I got to tell you, going in, you question what you know compared to what others know. And for anyone who doubts what they know as a chiropractor, you need to get over that. You know, particularly, we know we have the expertise in the neuromusculoskeletal field, but it was a real eye-opener for me. And what I really appreciated about it, once you did gain that respect, is the collaboration. You know, you don't have to be an expert in everything. Sometimes you just have to know a guy. That was probably the most rewarding 4 years of practice for me, is to be in that facility and to see it go from literally one room to a wing. Just absolutely amazing experience. And like you said, that's where all the sick people are. It's where people with back pain and neck pain and neuromusculoskeletal go. And what better folks to help than our veterans. So with your background in military healthcare and service as a chiropractor to Congress and the Supreme Court, what unique insights have you gained about that intersection between chiropractic and mainstream healthcare, particularly in the political and legislative arenas?
Well, taking care of Congress and having most of Congress coming in as patients, and of course, treating the Supreme Court, Chairman, the Joint Chiefs of Staff, White House people who live in the White House, there is chiropractic is broadly used and valued.
That's good to
And
know.
I remember at the Capitol, the physician would frequently, when I first got there, would bring in, if he had x-rays, there was no radiologist there. It was before we had telemedicine. So I usually would get first shot at those x-rays, and they would value those opinions on when we take films down there. There's points where, we definitely want to work together. And most people want a non-drug solution to the problems. People want to have that. Remember, I also was on faculty for the military's medical school. So I'd have people rotate through our clinic. And I remember there was a resident in a physical medicine residency spent a day shadowing me. And he at the end of the day, he said, I kind of wish I didn't have prescription privileges, because you're able to get to the source of their problems, where I spend half of my day arguing with my patients about their pain meds. And you don't even have to deal with that. So it's the gift of not having prescription privileges means you take that totally off the table. There's thousands of doctors out there who can write you a script. There's very few of us who can actually get to the source of your problem and help and try to correct that rather than giving you a pill. It's the easiest thing in the world is to give a steroid to cover up symptoms. No. Anybody can do that.
In my practice for the last 15 years, I was part of a spine center with 13 MDs, 6 neurosurgeons, orthopedic, physical medicine, rehab, the whole run of it. And it was interesting to see them transition from never referring to a chiropractor to actually doing it on a day-to-day basis. And I'll never forget my good friend, Dr. Raul Vora, physical medicine rehab from Baylor. He said, "Ray, I just love your patients. Not a one of them have asked me for drugs or painkillers or opioids." And that's something that there are some in the profession that look at that as a downside, but I think it is a gift in a lot of ways. The perspective that they have versus the perspective they have after they've worked with a chiropractor on a day-to-day basis is dramatically different. So on the legislative side or on the political side, I find it interesting that you had a lot of people from the Department of Defense and the decision makers, policy makers, utilizing chiropractic care. But man, we've had a hell of a time getting recognized as officers and getting the credibility that we should have at all treatment facilities. How do we change? What did you hear from them about where the resistance is, and how do we change that?
It's crazy. There's people who would never miss their chiropractic appointment and never vote in favor of our bills.
That's crazy.
It's hypocrisy. So people who literally would be angry if we couldn't get them in, but would never move our agenda forward. But that's, the world's changed quite a bit. When C-SPAN moved into Congress, in my room at the Capitol, I'd have 2 TV sets, one tuned in to the Senate side, one to the House. And I could, that way we could keep up find out there's a vote coming forward. So you kind of hear what's going on in the arguments, but it's become such a spectacle. And when I first got there, you actually had people change their views. Like you could go debate in the floor of Congress. And I've seen people say, you know what? I've changed my mind on that. Now it's pretty much determined before you get on the floor. I shouldn't get too political, but the head of your party might say, in one particular party, you're going to vote this way. If you vote any other way, you'll never get a seat on a committee and your bills will never see the light of day.
So your freedom of thought does not exist in the Congress.
Yeah, I'm a little discouraged by that. So, but with it, there's always a hope for, there's always throw the bums out, we'll put new people in, but we tend to like to vote in new bums too. So it's complicated. About being an officer in the military, I had I put 4 years active, 10 years reserve, then I worked for the Navy for 2 decades. I wanted to be the first officer in the military. There was a point where I was treating an occupant from the White House, chairman of the Joint Chiefs, the legislative sessions, and the head of the Supreme Court, and I was trying to become an officer, and I couldn't get it. I couldn't get it through.
Wow.
And there's more to it, because what I find is you can't just have you need to have a career path. So you have to have someplace you can, and people you're in charge of as you move. So the minimum number you would have to commission would be 9. And where the ACA and there's some other chiropractors who are very more engaged in this, we're trying to find a way to do this. So and here's how we'll be commissioned. The public health service is several, I think it might be 7 services now that we have space uniform services. Public health service has all officers. I think it's roughly 5 commissioned officers There's physicians, nurses, PAs, various MPHs. And at the end of and during World War II, but during Vietnam, it really swelled in ranks because people wanted not to join, they drafted the army, so they joined public health. And then it lost a lot of the folks there. So it had all these empty billets. So we were trying to get just 9 billets chiropractors, and they could go work in an Indian reservation or work for the military. And so you could be in the public health service wearing a Marine uniform or an Army uniform, an Air Force uniform, but your uniform would say public health service, and you could be loaned out. But we've got a lot of resistance from physical therapists and the exclamation course. There's a lot of resistance in the military from physical therapists who are worried that we would take their billets, to be honest with you.
Yeah.
That's how I see we'll probably break through that barrier is public health service.
I had a situation many years ago when, again, the physical medicine doc that I mentioned, he was at Methodist rehab facility here in Mississippi, and we worked together very closely on the workers' comp commission. So I had a great relationship, and he invited me over he said, man, you need an office here in the rehab facility. Bill, we were down to picking out the carpet. I had bought an x-ray and, just making plans to open up the clinic. And I get a call from him one day. He says, the CEO isn't going to let us do this. They don't want to there's somebody in the higher up of the foundation that doesn't want a chiropractor on the campus. And I went, oh my gosh. He said, well, I guess we'll just have to wait till he dies, Fast forward 5 years, I get a call from Raul. Ray, he's dead. Come on over. But some things only change one funeral at a time. So hopefully some of those attitudes will die off in time.
And we work with physical therapists and I have very good friends who are physical therapists. It's obvious at the ground level, we work great. It's the leadership. I had this is where I was working at Bethesda. One of my friends, physical therapists, referred another patient over. He wasn't able to help, but I like working on lumbar disc, referred an occupational therapist to me. He gets a call from the head of physical therapy for the Navy, who had gotten a call from the head of the Physical Therapy Association, who'd found out about this, and he had them both on the call chastised for referring to a chiropractor. Don't you know you're going to put yourself out of business if these guys get commissioned or they're successful? And he said, well, what about what's best for the patient? And for us, we work great with physical therapists and we love it. But when you get the powers up here fighting it out, it's like us mere mortals in the shadow of Mount Olympus are, getting hit with lightning bolts.
No doubt. I'll have to share this with you. Part of my career path, I was fortunate enough to be able to lecture to the anesthesiology residents and neurosurgery residents at University Medical Center here, home of Arthur C. Guyton himself.
Oh, nice.
I was invited at 6 o'clock in the morning. They're getting ready before their grand rounds, and I've got literally an auditorium full of pain management anesthesiologist residents, and went through a presentation, what chiropractic does, our background, our training, yada, yada. Wrapped up the presentation, and Dr. Ike, the guy that invited me, he got up at the end and he said, I'm just curious, of all of our residents here, how many of you see a chiropractor? And you could hear a pin drop. Nobody moved. And then all of a sudden, one guy stood up and said, hi, I'm Bill. I see a chiropractor. And then another one popped up, and then another one. They don't talk about it. So it's kind of like DOD guys that are seeing the chiropractor, taking advantage of it, but they can't tell anybody. It's absolutely nuts.
Similar thing happened down in the Navy Special Warfare Center. So I was, during my reserve time, I was a corpsman with a special warfare unit. And at one point I went down to a special warfare unit to do a refresher, and it's what's called special operations training, basically hyperbaric medicine. And I arrived a few days earlier, and I told the medical doctors, that I was a chiropractor in civilian life, and asked if I could adjust people. So they said, sure, go ahead. And they were assured me. Next thing I knew, all of SEAL Team 1 practically was lined up, including the Master Chief, for adjustments. And they're like, what? They couldn't believe it. And it turned out this is before chiropractors were in the military. They were all lined up down the hallway, and I was adjusting on a pool table. That's all we had. It was solid. And they were talking, and they're like, well, yeah, we've been paying to go to chiropractors on our own dime. And we're just, glad to have one here on, for a short period of time.
That's crazy. So everyone, we're going to take about a 15-second break to hear from our sponsors, and we'll be right back with you. Welcome back, everyone. We're here with the one and only Dr. Bill Morgan with Parker University. I want to pivot a little bit. You've been instrumental in the growth and development of Parker University, including initiatives like the Parker Performance Center. Tell me a little about the Institute and its visions and goals for advancing care and education for the students.
Yeah, well, Parker University is here in Dallas, Texas, and I've been here for 8 years now, just eight
Wow.
years. We've doubled in size, and it's kind of odd because we raised our standards and made it harder to get in, and we still are growing. Basically, I think it attracts more people than it deters. And we have 34 majors, and we're about 2,300 total students, and I think we're going to be over this fall for chiropractic students. And we've really invested heavily in the majors that specialize in human performance, because I believe that is where the future of healthcare is. And what we've done is I've taken my senior leadership team. We visited NASA. A friend of mine is the head of NASA. So we were able to go to their Human Performance Center, the Olympic Training Center in Colorado Springs, the Ultimate Fighting Championship Center. I've been up to Harvard. We've traveled literally to Europe and other places looking at human performance centers. And we really feel that we've invested in our strategic plan that we are going to make the most comprehensive human performance center in the world. We're already have things that NASA and the Olympic Center don't have. So I'm confident we can do that on our campus so that we can research what we do and how we affect human performance. And know that I'm saying human performance, not athletic performance, because for someone who's 65, living independently into their 90s might be the pinnacle of human performance. So along with that, we've created a healthcare center, and it's in the Dallas Star where the Dallas Cowboys are. 10 square foot state-of-the-art center, this Parker Performance Institute. It has medical doctors who are neurologists. We have nurse practitioners, chiropractors, chiropractic neurologists, people from our nutrition master's program, people from our strength and human performance program. So we create this synergy to help people grow and heal. And a lot of it's based on healing the brain. And from my experience working with traumatic brain injuries at Walter Reed and Bethesda Naval Hospital. And what we've done is created a center that really enhances neuroplasticity along with the physical rehabilitation and chiropractic care that we've embraced.
That's awesome. I love that you're embracing the performance part of it. Clearly, the average person goes to the chiropractor because they're in pain. Well, let's face it, if your goal is just to get out of pain, people can go take stuff. There's a lot of ways just to do that. As chiropractors, we get to the underlying problem, which ultimately does increase their performance, which lets them do the things they truly want to do. And sometimes just focusing on the pain is the wrong way to go. It really doesn't change the outcome for the patient long term. And I also love you make the distinction between athletic performance and human performance. As someone who just had a mom and dad, see them go through, they don't walk, they don't exercise, they're sitting in the recliner. Now they got a recliner that lifts them up. Now they got to have an incline bed, because they have trouble getting out of the bed, and all these things that are designed to, quote, help us. And while I know they're necessary in some cases, they disable us. They absolutely take us in the wrong direction. So
you're exactly right. We're making connections with other people who feel the same way. Dr. Ken Cooper, you may know him from Cooper Aerobics.
in there, yeah.
So Dr. Cooper he's 93. He still puts his white jacket on, sees patients every day. He gets it. Health does not come out of a pill bottle, and that he's the epitome of what I'm calling 20 more good years. So if I'm 65 and I want to be vibrant for another 20 years, I'm not even trying to make the goal of living to 100, which I think is possible, but to have 20 more good years, that's our goal. And we're going to really emphasize that with our seminars. And as we attract the different speakers, people who support that. Because ultimately, I think our philosophy is chiropractic, we remove the very good health to allow the body to heal itself. And that with where we're going with this is to really help people live those longer periods of life with health. Right now in the United States, the average man will have 63 good years, and then they'll get their diagnosis. Usually it's one of the four big ones: cancer, diabetes, heart disease, Alzheimer's. It could be high blood pressure, other things. But at 63, you're now permanently treating a disease. Your good health is down, but you'll live till you're 79. That's a long time of being sick. My goal would be to make it where you'll live till 85 doing what you want. And if we can make it for myself, if I could go scuba diving the day before I die,
awesome.
That's it. That's the goal.
Yeah,
doing what you love the day before you pass.
Yeah, well, I have hit some of those milestones being 67 years old. I'll never forget it. I went for my annual eye doctor appointment, and I went in and he says, I was telling him my contacts weren't working as well, and I ride motorcycles, and it's like I'm having some time difficult time seeing the signs sometime, and they're big signs. And he comes back, he says, well, Ray, you've got an astigmatism and cataracts. I said, Dr. Whittington, I didn't have this crap before I got my Medicare card. I'm seeing that damn thing back. Never happened before then, Bill.
It's true. And the good news on turning 67, it's only temporary.
Well, never thought of it that way, but that's a good point. You also mentioned the barriers to health, and a lot of people, I think of those as external barriers. And the reality is oftentimes we're the barriers. And, either people just don't know, or they don't care, or they hadn't got to the point where they, what's that saying? If you don't have time to take care of your health, you'll be forced to take time to take care of the disease.
Truly.
So, truly, the four top things that you mentioned are all lifestyle diseases, or the majority of them are.
Exactly.
Yep. So got to help people play a better game. So you've been involved with the Texas Chiropractic Association, American Chiropractic Association. It's been extensive involvement. I know that when you were fighting the battle on diagnosis and being able to treat patients and literally rendering a neurologic diagnosis, which is bizarre to me as a chiropractor. How do you see the associations of really shaping the future of chiropractic care, and what role do you see them playing in advocating for our profession? I get frustrated when I hear that only 25% of the profession belong to either national organization, and I think the numbers are around 50 belong to the state associations. What would you tell the average practitioner about the importance of showing up, speaking up, and getting involved?
It's duty. It's our duty to advocate for our patients. And when you choose not to be a member of your association, you're letting somebody else fight your battles for you. And that is not the American way. Americans fight their own battles. That's what we're known for. And if you don't join an association, you've advocated your responsibility as a warrior. And again, part of being that provider is we want to be, we want to have the clinical skills that we have, but being clinical, politically active, also being a patient advocate. You want to take care of your patients. If you really believe in chiropractic, you need to be there for your patients, because they can't fight for the rights to see a chiropractor. It's our job to fight for the rights and to have an option that doesn't involve healthcare coming out of a pill bottle. And we want to be the advocates that come forward and here's how you live those 20 more good years. We're your coach. You're going to come here. I'm going to adjust you, make sure your joints are moving freely. But I also am going to advocate and talk to you about sleep habits and your nutrition and your weight and exercise. And it does make me sad too when people they discard their responsibility and let somebody else fight their fights.
Yeah, it truly is a challenge. I've been involved in our state association forever, and certainly on the national level as well. And to me, it was just never an option. It was an obligation. And for those that don't want to be politically involved, I get that, but at least do something to help those that are willing to do that. Just expanding it's one thing to go down and advocate to expand chiropractic, the scope or reimbursement and that type thing. And, it's always a battle to do that. But the reality is we aren't fighting for us. We're fighting for the rights of our patient. I mean, let's face it. You may have chiropractic coverage on your health insurance up until you're 65. And at 65, you get one thing covered. And you can gripe and complain about that, or you can support efforts to change that. It just, I would challenge the doctors that are apolitical, don't want to get involved, to realize that the only reason they have a license is because someone was political and did get involved. And so we owe it to our patients, and we owe it to our future generations.
Preach it.
Yeah, brother. You can get an amen and a hallelujah maybe. So besides the Performance Institute, and by the way, I had the privilege of being on your campus, and you gave me the private tour, which I really, really appreciated. Absolutely some amazing things going on there. Mind-blowing from compared to what many of us that are older went through in training. So besides the Performance Institute, what other new initiatives or expansions are you looking at?
Well, we got blessed by a tornado 4 years ago, and so we had
perspective.
So a clean slate wiped out. And frankly, we were a little concerned about staying open until another gift came called COVID. So the students went home, gave us a chance to rebuild. But what we did, we visited the most modernly built healthcare facilities, educational facilities in the country, took what they were doing and added here. So we essentially, every classroom is a TV studio so that you can we record all the lectures so they can watch it at their leisure in study groups. So, and we've in this building right here, as you know, we've modernized it. We have force plate adjusting. We have virtual reality. We have virtual dissection. We have up to 100 cadavers across the way here that are being dissected at a time. We're really heavily vested in the science. We're going to replace our physiology labs with human performance labs. Dr. Cooper's going to help us design a cardiac lab. So when you're learning cardiac physiology, you're going to be there with our echocardiogram majors looking at what the heart looks like while it's functioning, and with EKGs, and really understanding it. Now, not that you might not use that in practice, but at least when you go to a hospital, you know what's being taking place there. And we've also gone like for orthopedic testing. We've hired the author of one of the great books on orthopedic testing, had him flow out. He videoed every one of those orthopedic tests that we're all required to know for the boards. And we have those in our library. Neurology labs, we've done the same thing. And we've had the neurologist do the test on someone with pathological reflexes. So this is what clonus looks like. This is what our positive Hoffman looks like, so that we're exposing that to them, and then creating virtual reality scenarios so that you put these goggles on and you walk into a room and you'll see that patient that you might only see one or two of these cases in your entire lifetime, but you've been exposed to it so you won't miss it when they walk in your office 30 years from now.
That's awesome. You know, looking back in my career, and I feel like I got a great education at Cleveland College, absolutely wonderful. But one of the challenges that I've just seen in general with chiropractic, again, having had that experience at the VA, is, let's face it, and the typical may not be that way at Parker, and I'm sure some other schools, but historically, clinic has been taking care of people that were handed down by the interns before you. And we might read about clonus, or we might read about a particular condition, but seeing it is entirely different. And that's one of the edges that I've felt like medical education has had, is you want to see someone with end-stage renal disease, you want to see somebody with a cardiac problem, you want to see someone with whatever the condition may be, let's go up to the 4th floor. Let's go up to the 3rd floor and actually see that. You don't forget the things that you see and experience. It's easy to forget things that you just read about. So I'm really excited for the future of the profession, that we are getting more real world experience and seeing some of these internships, things develop with medical facilities. And certainly the VA opportunity is, I think, will go down in history as probably one of the big game changers, despite the fact that some felt, what are chiropractors doing in the hospitals? What are you seeing happening? I have read a lot recently about the pivot in medical education, nurse practitioner, physical therapy, that because a lot of this is didactic, a lot of them have moved towards online hours and online training and virtual training. Clearly, as a chiropractor, we're hands-on. You've got to learn that component. What are your thoughts about more and more of just the didactic part of education? What's Parker doing in that realm?
Well, we've looked at that. And to go back to what you said, most of the education takes place clinically. So we have 20 hospitals we're affiliated with, 250 external clinics as well. There's certain classes, and with COVID, we learned a lot about what could be done, what should be done, what shouldn't be done. So we have an option where students can do their first 4 trimesters online for the classes that, certain classes are better taught online. I would say when you look at histology, micro, radiology, those are better taught online. So in large classroom settings, we can go ahead and put those together, and we can actually have them, like for the people who choose the online option, we'll give them Oculus virtual reality goggles, and they can go in and see their class rate. They can simulate doing a physical examination on patients. And then we do, so it's that 1 year, and then they come here for a 1 year intensive hands-on. And we've started that. And actually, when they dive in full on hands-on, it's actually, I think it might work better than the other way. My commitment for anybody who does it online, and this is still our beta test on this, we're working our first few cohorts through there. We're finding out how they're doing the boards, how they're doing clinically, and do we need to bring them in a few more times throughout that year? We definitely want them to come to our seminar so we can get some hands-on. So the goal is to get them prepared for clinic. Clinic is where the goal is. And Eric Ulster was I think I might have that name wrong, but there's this physician, Ulster, was in Canada, who really emphasized the clinical side of things. So what we want to do is learn as much as we can didactically, but working under a master in a clinical setting is where most of the education takes place, where the true the healing art comes out, that we learn how to become those physicians. And we want to really emphasize that, making Parker Performance Institute up in the star. So we attract lots of complicated cases so that you're not just reading about these cases, you're going to see some complicated cases. So we're
Yeah.
making our own clinic, which is instead of being, campus clinics like most schools have. If I'm successful in an expanded Parker Performance Institute, we will have exposure to those patients. And also, I've made it a place those in our online program that you will get more hands-on than other people's in-person program. So when you're here, you're going to get hands-on. In fact, our adjusting labs are open before school, at lunch, and after school. That if you want to bring your friend in to go work on an adjustment on your off hours, we have teachers there who will help you work on those adjustments.
It's been interesting to see the technology evolve and that allows students to practice what they're doing. I don't know if I'd say I've had the benefit or been a victim of students adjusting while I was in chiropractic college.
Yeah.
Oh man, I don't know that the surgery residents actually get that type of
Yeah,
training with their colleagues. Probably not a good idea in some cases.
Or you've seen what we've done with our mannequins and the force plate, though. So we'll get hundreds of reps in before you put a human in there. And we can attenuate, like we can over there in our force plate adjusting lab, they can spin this like roulette wheel and they'll say, okay, Ray, we want you to give them a Newton preload with a 500 Newton thrust. And give me 3 of those. And the students will be able to do it.
Yeah.
And they'll learn
muscle memory. Yeah.
Yeah, exactly. And then you put a human there, and the new mannequins that I'm seeing out of CMCC actually have zero friction, like your skin. So then when you do it, as you do it, it actually has a more realistic feel, and you don't, because people think they can do rotational adjustments. And as we learn more about the adjustment, there's some of the old school thoughts of adjusting are being replaced with new evidence, and we're applying that evidence to the adjustment.
That's awesome. I don't know if I've told you, my mother and father were both chiropractors, and all my mother ever did was work for a chiropractor before she became one. And of course, I've grown up around it all my life. So as a very small child, probably 5 or 6 years old, I decided I was going to adjust my sister, Ann. And she was bedridden for about 2 weeks. It was not a very good experience for her. So I love seeing some technology come in. That's awesome. So looking ahead, what do you envision for the future of chiropractic care, both in terms of clinical practice and education?
Well, education and all of education is hitting an enrollment cliff. If you've not heard that, in 2008, we had this little financial crisis. And at that point, there was 15% less childbirths. So they would graduate in 2026. So we're going to have a sudden reduction in high school graduates, leading to undergrad, diminishing in undergrad. And we've already seen a 15% decline since the high of 2000. And so it'll be 30 or more decline in people going to college. So while the demand for chiropractic is going up, there's less and less students coming. I'm seeing some of the other health fields expanding, like physical therapy. I think they're actually expanding their programs to the point where they may overexpand. There's less and less applicants for some of these other fields. So I think there's going to be a point. It's going to be a point for some colleges, not necessarily chiropractic colleges, but undergrad colleges, liberal arts schools are going to go out of business. And some estimates up to 30%. So we're heading into a very unique time for higher education. And those who have not anticipated this change are probably in for a rude awakening. So what we're trying to do is differentiate ourselves to make sure that we are the human performance place that all of our majors that we have, I think we have 9 master's degrees and many other programs here, point towards human performance, enhancing that and attracting that. For the profession, there's more chiropractors are needed, but we're having less people graduating from high school. So it's kind of a rough road. I don't know where that's going to lead, but we're going to do everything we can to keep producing high quality chiropractors and give them every tool that we possibly can to help them succeed.
Yep. I was just doing a podcast before we got on and brought up a stat that one of the gentlemen that works with us, he's done a deep dive on the workforce. And so it's not just in students, but, we as chiropractors who are oftentimes heavily dependent upon staff, not tomorrow, but in 10, 15 years, people are not having babies like they used to. Mm-hmm. And there is not going to be, there's already like 2 point some odd jobs for every person that's looking for a job, but there aren't that many, there's not going to be as many in the pipeline. So that's only going to grow. And you're spot on. I believe it was the Department of Labor statistics show that chiropractic can expect about 11% increase in utilization, and got to fill that pipeline. Interestingly enough, we were, I believe, one of the if not the top, one of the top growing fields in according to the Department of Labor. So for those that are in childbearing years, do your job. We got to fill
Yeah.
up the chiropractic colleges. So are there any emerging trends or areas of innovation that you think will impact us in the coming years? Anything you're seeing?
Well, I'm looking, of course, AI is everywhere. I'm hoping AI make our EHR dilemma better because it's always hard to do notes. I'm hoping that helps. There's certain jobs that are going to go away. So when we talk about a 15% reduction in childbirth and then plus a lot of people left higher ed with frustration during COVID, you pretty much AI can't replace these bad boys. So if you're a graphic artist or a writer, you may come back to school and have to retool. So I think we're going to see a lot of people coming to chiropractic as a second career. And as you've seen the stats, so there's going to be a lot of professions that are just go away and people will still want to work and they may have to retool, come back to chiropractic. And chiropractic is such a fun way to make a living as well. And if you love people, it's just so great.
No doubt. Just as a side note, if those of you that are in practice and wondering how Chiro AI can help your practice, we recently invested in and launched Chiro AI. It's a service that we have. We've given it to the profession. There's no charge for it. You can access it by hitting our website. And I'm still learning as we go along in this project. And I just, for giggles, ask it to write me a series of 5 social media posts or 5 emails that talk about chiropractic and the benefits for those that are pregnant. Holy freaking cow. Unbelievable. Just some of the day-to-day tasks and the things that we do are such time savers. And again, we don't understand all we know about it yet, but man, from what I'm seeing, it absolutely is going to be a game changer for all of us. So embrace it. So got a couple of fun questions. I know from spending time in your office with you and had a nice long chat, you're a voracious reader. What's the last book you wrote or read?
Courage to Execute. Or let's see, I'll get it out right now. Yeah, I believe it's Courage to Execute. It's kind of a military theme to it. I started off like, oh, this is one of those other military books, but no, it was really good. I'm also reading 48. Let's see. 48 Somethings of Power. If I grab my phone, I can tell you quite a few. But I do a lot of reading. I also like Simon Sinek's book about the infinite game. He just spoke at Parker Seminars. That was quite good as well. So
yeah, I really appreciate you bringing him in. We had our whole team there, and I'm a big fan of Simon Sinek, and we really got a lot. Y'all are killing it at Parker Seminars. Much appreciated you getting him in there. What's a talent that you have that most people don't know about?
A talent I know. I'm an avid shooter. I build firearms. I'm an avid scuba diver. I'm an underwater photographer. So I've been diving for 52 years. I learned how to scuba dive in 72 and was a military diver. And so that's probably my 2 big ones. Plus I was before I went in the military, I was a horseshoer. I was very much a horseman.
Well, I certainly did not. As Johnny Carson used to say, I did not know that. And I will have to explain to some people who Johnny Carson is, I guess. What's the worst job you ever had?
Oh my goodness. Well, I remember I was working when I went in the military. I worked at a feed store, and the guy who ran that feed store was mean as a snake, and he worked me like a dog. I was bucking bales of hay and making deliveries, and it was a lot of hard work, and my boss was pretty mean. So boot camp was actually easier than working for that guy.
Yeah. My early experience was working in a catfish pond. I don't know if you've ever seen how they harvest them, but they have a tractor on each side with a seine net, and it drags all the fish down to one end, and me and a bunch of other guys are at the other end tossing fish out in the occasional moccasin. Very, very good motivation to go to college.
That's a fact.
Yeah. Well, I really appreciate you taking time to spend some time with us today. And thank you all for listening to the ChiroSphere podcast. Please subscribe and share the podcast with your friends. Let us know who you'd like to hear from in the future, and we'll be glad to get them on. If you want to learn more about ChiroHealth USA and how we can help you develop a compliant, profitable discount strategy that will absolutely grow your practice, income, and profitability, call us at 888-719-9990. Or visit our website at CHUSA.com. That's how you spell CHUSA. And you'll find out why ChiroHealth USA is the network that works for chiropractic and you. Make it a great day, everyone.